C20 India 2023 envisions a conception of civil society 2.0 in a world where individual, family, society, market and state can understand their respective roles better and supplement each other rather than engaging in conflicts. This year, the C20 symbolizes the flame of hope, self-motivation and selfless service.
Amma is grateful to the Indian government for arranging such a high-quality meeting. All the issues raised here are vitally important. This should go beyond a mere physical meeting and become a true meeting, a meeting of hearts and minds. This is the only way to awaken ourselves and others.
This year, C20 working groups will focus on integrated holistic health, mind, body and environment, sustainable and resilient communities, climate, environment and net zero targets, education and digital transformation, gender equality and disability, technology, security and transparency, lifestyle for environment, preservation and conservation of traditional arts, crafts and culture, human rights as human values, revival of rivers and water management, seva, sense of service, philanthropy and volunteerism, Vasudhaiva Kutumbakam, the world is one family, diversity, inclusion and mutual respect, SDG 16 and promoting civic space, delivering democracy through participatory governance.
Om Namah Shivaya, Namaste to all. I am Vaidya Ram Manohar from Amrita, the lead for the Holistic Health Subgroup of Integrated Holistic Health Working Group of the C20 2023. It gives me great pleasure to welcome you all to the webinar on traditional medicine, practices and potential as part of our C20 outreach campaign. As you would be aware, the C20, Civil Society 20, is one of the official engagement groups of the G20 that provides a platform for civil society organizations around the world to voice people's aspirations to the world leaders in G20. Our mandate is to draft policy documents called policy packs based on the inputs from CSOs and NGOs, reflecting the primary and common concerns affecting the world's peoples and to promote social and economic development, leaving no one behind. We have a list of distinguished speakers for this webinar on traditional medicine who have a very rich experience and engagement with the field of traditional medicine, covering all the IHH systems. So they will enlighten us on the key issues that we need to consider when formulating a policy for traditional medicine to contribute to the goal of holistic health from the C20 perspective. We have about an hour for this webinar and 8 speakers, and each of our eminent panelists will speak for 5 to 7 minutes, and we will not take any questions during this webinar. We will keep you updated about future interactive events that we are planning in the coming months. So the first speaker for this evening is Mr. Rajiv Vasudevan. He's the CEO of the Ayurveda hospitals, which was the first to get an ABH accreditation in the field of Ayurveda, and he's also Ayush Chair at Confederation of Indian Industry. I request Mr. Rajiv Vasudevan to share his thoughts. Over to you, Rajiv Vasudevanji.
Understand that how we go between how it becomes the fabric of society. It's so important, the fabric of life, which unifies the government on one side, the market on one side, the other type of, and the organization which cement the ordinary family and the household and the community together, right? So what are the priorities? And when you look at C20, you did mention what C20 is attempting to do, but it's important to keep in mind what exactly they define. It's a platform to bring forth proposals and demands arising from civil society relating to environment, sustainable development, gender equality, human rights, social, economic, and climate justice. It's a huge umbrella of objectives to be covered. What it told me immediately when I read this particular thing is the indivisibility of this total set of objectives. You can't split one and say that I just want to look at social justice and not achieve economic justice or climate justice. So it is a continuum. It is indivisible and interdependent. And therefore, these two things are what constitutes what the role of traditional medicine could be potentially in defining this. So as we look at this, when we define holistic health and integrated health, etc., holism or holistic health, when you look at, it's not just the whole per se. It is not just body and mind. It is body, mind, spirit. Some people also include social health, etc. So emotional health, etc. And why does traditional medicine come here? Because when I look at an integrated approach in a public health system, which has traditionally been driven by a biomedicalized paradigm, where we look at physical health, we look at disease rather than the health and well-being of individuals and communities, where there is a need for a complete shift in paradigm where the patient is a passive beneficiary or the individual is a passive beneficiary of public health services, or as opposed to a community which is actively involved and participating in the process of receiving health and interacting with others who are part of that community. To go from drugs and vaccines and that type of approach to an approach where we're talking about empowerment, enablement, autonomy, right? Why do we bring this in? Because this change in paradigm, which has been enunciated by many CSOs, in reality is sorely lacking today, right? Why? Because it is completely driven by this biomedicalized approach of health, which is ignoring the wisdom of traditional systems of medicine. This is the first point. Therefore, when we talk of what WHO in 2012 talked about whole of society approach, there is this very, very popular terminology called whole of government approach, where all parts of government come together. But there is a much more all-encompassing term called whole of society approach, wherein it is a collaborative governance. In some states of India, you see that happening. Like Kerala is a very good example of a greater degree of this collaborative governance. So how do we bring that, and how does Ayurveda and other traditional systems participate here? So when I look at healthcare, going away from tertiary quaternary care, I need to look at care from preconception to conception to delivery to birth to cradle to grave, that entire life cycle. And in this continuum of care, there is an evolution of health needs. If you don't look at health that way, and rather than just look at, oh, I have to give vaccines, I have to give vaccinations, I have to give some emergency care, I need to look at this continuum of care. We have to look at rural, peri-urban, urban care, primary, secondary, tertiary care, etc. When we look at it, from the village primary health center to the taluk hospital to the district hospital to a state level center of excellence, how do we really build this continuum of care so that people get appropriate level of care which is accessible at every point where he seeks such help? My submission in this preventive healthcare cycle, from primal prevention to primary prevention to secondary prevention to tertiary prevention, we look at it as a totality of that preventive continuum. Ayurveda and traditional systems of medicine have a huge role to play. Why so? The role for man in relation to his environment, the role of diet and lifestyle, the mental factors, external factors, such as the pollution in the, the air pollution, water pollution, etc., stressors, occupational health, comorbidities. In Ayurveda, what we call the Pancha Nidanas, the 5 etiologies, so well defined 3,000 years back, right? So when we look at metabolism and inflammation, Agni and Ama, those core disease, pathological mechanisms which are aggravated by inappropriate diet and lifestyle. The fact that I look at swasthya, which is positive health, as opposed to disease and pathogenesis. Why do I bring this up? How do we bring a functional definition of health, which will empower communities, not depend on going and taking blood tests and this blind rush to taking laboratory tests, to get laboratory tests to define my health, as opposed to that, how do I look at my functional health? Ayurveda brings this all-encompassing approach and an intervention which is personalized in terms of diet, lifestyle, medicine, therapy, and counseling, the mental health, a multi-pronged approach. I would like to, as I wrap up, when you look at the National Health Policy of 2017, which is going for revision, much has been said in terms of visioning, right? How all these systems come for a pluralistic system. However, in reality, the role of traditional medicine has a lot more to increase. If you look at the civil society organizations in healthcare today, when you go into their websites, they talk all the main things, but you don't see traditional medicine there. Therefore, whether I look at ABPMJY, health and wellness centers, all these areas, I should say a new paradigm for health has to be forged. And for that, I propose that as a result of these deliberations arising from C20, I hope that by the end of this particular period, India can take the lead in bringing together CSOs and other players who are part of the public health initiatives to create a forum that will focus on giving direction to all these stakeholders on how traditional medicine can actually play an enabling role in collaborative governance and enabling healthcare for all at all times. Thank you very much.
Thank you, Rajiv Vasudevanji, for your very insightful remarks and guidance. And you rightly pointed out, the holistic approach as is needed in the C20 engagement, interlinkage of all the C20 components and also the whole society approach. Now we'll move on to Dr. Geeta Krishnan. So, Dr. Geeta Krishnan, are you ready?
Yes, Ram, please go
So
ahead.
Dr. Geeta Krishnan is an Ayurveda physician by training and has been serving as technical officer for traditional and complementary medicine at the World Health Organization, Geneva. Earlier, he pioneered the establishment of an integrative medicine department at Medanta hospitals. I cordially invite Dr. Geeta Krishnan to share his thoughts on policy issues related to traditional medicine.
Thank you, Dr. Ram Manohar, for having invited me to this very important meeting. And I would also like to thank Rajiv for having set the pace for and the foundation for what we are going to discuss today. I would like to specifically focus on the area of health and then probably extrapolate a little more on areas related to sustainability and other areas we are discussing today, especially on One Health. But specifically, when we talk about health and holistic medicine, I would, or from my experience, I would say that there is a lot of possibilities available by including or integrating traditional medicine into clinical practice, which of course, is coming out with evidences, with a lot of research work happening across the globe in different fields, starting from including from molecular biology to microbiome to Parkinson's disease management. Like a very large spectrum of research and evidence is coming out and is slowly getting integrated into the activities of health systems and clinical practice across the globe. I would like to also specifically mention on mental health and health related to nutrition and old age at this specific inputs from traditional medicine in this area. Building upon this possibility of clinical practice, it is definitely imperative that we take forward three basic areas in public health. They are, from my point of view, related to the sustainable development goals, which we have to achieve by 2030. And all the countries of the world have put their effort and also their commitment for achieving this. And we can specifically see that there are three of these areas where traditional medicine can be of great help to all health systems across the globe, especially those health systems where traditional medicine is there, and also those health systems where traditional medicines are being integrated. So these are, one is improving the accessibility for health for everyone. The idea is to leave no one behind, and for that, the current system which is available across the globe is not enough, and it cannot do enough within the short period of time to achieve what we want to achieve. That is the best of possible health for everyone across the globe, leaving no one behind. For that, all resources available for humankind is required to be utilized in the most appropriate manner. And traditional medicine is one such major resource, and we cannot ignore that. So we need to include that. The other area is trying to bring in the economic benefits of utilizing traditional medicine in the appropriate manner in health system, especially in very specific areas where unmet needs of modern medicine is quite looming and quite visible. I would say, for example, what is happening at the management of the lymphedema by filariasis, or management of Parkinson's disease using Ayurveda as an integrative practice. So these are just one or two of the examples which I can tell you. The others are such as for oncology or for management of like side effects of cancer treatment, or even cancer treatment itself. Like there are many, including pain management, etc., which needs to be included, not only for the benefit of clinical outcomes, but also for the outcomes in terms of economics, like reducing the cost of managing diseases, reducing the resources required for managing diseases. So that's something which we can do and which we need to do. The third and very important another aspect is to understand that the number of people living for longer period of life or increasing number of years are exponentially increasing across the globe, and we do not have enough resources to manage this old age population. And traditional medicine offers the best of cure or care for such population. Let me remind you that old age care do not start when you are old. It actually starts much earlier in the life cycle of a person. And traditional medicine have the right kind of armamentarium with it, and the right kind of knowledge which can be utilized in the appropriate manner to make sure that our population who are living in the next 50 to 60 years age well and live a healthy life throughout this whole period. So this is something these are the 3 points which I which I hope that we will be able to focus on more clearly and with more specificity as far as India is concerned, as well as other G20 countries are concerned, which is also for the usefulness of every other nation across the globe, because it will become rightfully useful examples which other countries can also follow with much ease. So this is something which we need to do. We also need to focus on one other point which Rajiv slightly mentioned, which is self-help care. Self-help care is something which is basically appropriate information and knowledge given to the society, and making the society responsible and owners of their own health. And that is something which is possible, which is not appropriately addressed until now. We have a lot of information and knowledge based on traditional medicine, especially on culturally prevalent habits and activities undertaken by different societies across the globe. If we can identify the right kind of approach for this and right kind of information out of this, and make sure that people get the information in the right time, in the right kind of communication, we will be able to do what we want to do and we will be able to achieve what we want to achieve. With this, I would like to stop or conclude my presentation. Thank you so much for having given me this opportunity.
Thank you, Dr. Geeta Krishnan, for that very thoughtful deliberation and pointing out specifically those 3 areas where traditional medicine can make significant contribution, improving accessibility, economic benefits, and also taking care of the aged population. So after having heard from the Ayurveda perspective and traditional medicine in general, I would now like to invite Dr. Sujata to share her views from the perspective of Siddha medicine. Dr. V. Sujata is a sociologist and a professor at Jawaharlal Nehru University, Delhi, and she works on the epistemic transformation of traditional and indigenous medical knowledge and the role of the state market and social relations on medical networks. Dr. Sujata.
Yeah, thank you so much, Dr. Ram Manohar, for this putting together this panel and gives me an opportunity to listen to experts in the field of medicine and on a very topical matter, integrated holistic health and thinking about the future. And I'm a sociologist and a sociologist of medicine who's been looking at medical pluralism or the conditions under which medical systems can coexist, what relationships inheres between them, and what kind of changes they undergo over a period of time. Now, if you look at medical pluralism, it's become a household name 3 decades ago. North America and Europe had opted, were already starting to move towards complementary and alternative medicines 3 decades ago. But till now, it was thought that traditional medicines were more suitable for chronic and long-term diseases. We have experts in the panel who have also mentioned that. But whether the fevers and infectious diseases were best under the control of biomedicine. This was the general assumption and practice. And besides Ayush, the traditional systems were mostly in the private sector. But the COVID pandemic has created a rupture of many kinds. Of the many things it did, it has the crisis it created and the emergency situation that it presented. It led to many South Asian countries turn back to home remedies and traditional medical recipes. These practices were not found that much in North America or Europe, or where mostly where a lot of nutraceuticals were consumed. But in South Asia, people turned to traditional medicinal recipes, also in Africa. And the government of India actually advocated Ayush, brought the Ayush protocols for COVID. So in this brief presentation, I want to foreground the intervention in Tamil Nadu, where Siddha medicine, which is a form of traditional medicine found in Tamil Nadu, was used in public health. And what is unique about this intervention and what we can learn for the future about the potential of traditional medicine to deal with pandemic-like situations is that's what I would like to foreground in this panel. Now, in Tamil Nadu, since 2007-8, where dengue was widely found and was beginning to become a menace, the government at that time urgently got the Siddha experts. They wanted to find out if there is some remedy that can be widely distributed to children, which is safe and free of toxicity. So they advocated other Siddha medicaments might be difficult to get, and they are better administered in the clinic. So what could be used as a public health preventive for infectious fevers, vector-borne fevers? They introduced a herbal preparation from the formulary called Nilavembu Kudineer, which consists of 7 ingredients, but which is it's a dry powder form and it could be mixed in boiled water. So Nilavembu Kudineer was widely distributed to treat dengue. They used coffee vending machines during rainy seasons. They gave school children Nilavembu Kudineer. It's a bitter drink, but still people widely consumed. They used to consume it traditionally, but these practices had died down. So it was favorably viewed by several studies, government officers, that Nilavembu Kudineer did help to control the infection, but there was no documentation or systematic study. So when COVID happened and the outbreak was so sudden and officials were faced with the situation of controlling it, the expert committee brought in Kabajura Kudineer, which is another a recipe from the Siddha formulary for mass distribution. And they had to take certain protocols to ensure its safety and toxicity and avoid, since it was going to be distributed publicly. So if you notice, after the COVID incident, several clinical trials were registered from Ayurveda and Siddha, even more than biomedicine is what the data is showing. And so this Kabajura Kudineer, which is a powder, again to be consumed with boiled, boiled with water and consumed hot, was widely circulated free of cost, was produced by the government traditional medicine factory, Tamcol and IMCOPS. It was at 10 rupees per dose. It was to be consumed once a day or twice a day. So this practice received widespread social acceptance. It was promoted by religious trusts and civil society organizations. And so I see this as a case study of frugal innovation, where apart from the preparation for vaccine, etc., there is a public health intervention, a simple one, easy to be promoted. It can be made free of a cost or at a lower cost, and it is safe. It consists herbal preparations, and there was widespread support of civil society. All religious organizations, schools started doing promoting these herbal preparations through coffee vending machines and other quick ways of preparing the preparation. So my point here is, we cannot have vaccines for every new mutation. And if we have a germ-based understanding of infectious fevers, then we have no option but to develop vaccines, which are, while they are necessary, are hugely expensive, and it requires a huge machinery to mobilize them. Therefore, traditional medicine can play a very significant role, not just in preventive, but also in the treatment of mild and moderate cases, as they did in the case of COVID. They used the Kabajura Kudineer to treat mild and moderate cases. And this time there is some documentation. And there were integrated clinical trials of allopathic and Siddha Kabajura Kudineer management, and these results have also been published. So when we think of the future, while we develop traditional medicines for chronic and long-term ailments, they also have a huge potential to control epidemic like infectious fevers. Even though they may, people may ask, they don't have a theory of the germ or of viruses or bacteria. The theories behind traditional medicine is host-based approach. They focus on the body constitution and understand fevers, classify fevers according to whether they are caused by pitta or vata. They have a particular theory for that. So they have a host-based approach to infections, and they are useful to prevent and they are easily acceptable to people, and they are cost effective. They can be used along with allopathic management. And I see this as the future of people-centered social medicine, that traditional medicine should not be made only into products or commodities that are purchased by people who can afford to purchase them. But we also have within traditional medicine the potential for having decentralized, sustainable ways of handling pandemics in an integrated way. So, but this will call for greater attention to documentation, testing of protocols, making these medicinal ingredients of good quality available, and also augment the international collaboration with other South Asian, African, and other countries, because many of these herbal ingredients are also available, are used for various things in other countries of the global South. So this, I think, is a very big potential of traditional medicine in public health as a frugal innovation. So I'll stop here and thank you.
So thank you so much, Dr. Sujata, actually, for also bringing in the udaharan of, traditional Siddha system and how the Siddha practitioners, encountered the COVID pandemic. So the next speaker is Dr. Mathulika Banerjee. She is a professor at Delhi University in the Department of Political Science and presently fellow at New Institute, Hamburg, Germany. In 1996, she obtained a PhD with her thesis, Power, Culture, Medicine, Ayurvedic Pharmaceuticals in India. I'd like to now invite her to share her, views on this forum.
Thank you, Dr. Ram Manohar. Indeed, I agree with all other speakers that this is a much needed and a very welcome panel discussion. And thank you very much for inviting me to be on this. It's indeed a pleasure and also a privilege to be with others who are so active, so knowledgeable, and have made such an impact in this arena, including yourself, of course. I admire many of the people who are here, so it's a privilege to be with them on this panel. I would like to speak about three things. In fact, two of them will actually be building on what Sujata just had to say, my old friend and colleague Sujata had to say. And I'll just try to spell out these things. As social scientists, you see, we bring a different kind of perspective on understanding the Ayush systems. And I think that it's best that we complement what needs to be understood about them in the health system to what the others who are practitioners or are dealing with industry, etc., know from the other side, as it were. I think that one of the first things that I would like to say, we really need to emphasize, whether at the national level or at the international level, WHO, anywhere, is that Ayush systems are not a poor person's option. It's not that because they cannot afford biomedical healthcare or the expensive medication or expensive treatment, that they would then have that we encourage Ayush systems because they can be accessible. Accessibility today, in the light of much else, and I will talk about that as well, is a very important and very responsible position to take on whether it is healthcare or food or any of the necessities of everyday existence. So I think that it's very important to understand the knowledge for its own strengths, the fact that, they have the qualities they do, which all the other speakers have emphasized, and that they are able to take care of a great range of health and disease conditions. And the fact that we are talking about the health of the person, the life of the person, as Dr. Vasudevan also emphasized. So I think that this is what needs to be continuously emphasized. And I think that it would have more currency and would be more accepted in this particular respect if the support to the Ayush systems are not only in terms of just support to the industry, because a lot of the support from governments particularly has been to industry, which is great and which is important. But it's important also to recognize that at the local level, when we mobilize practitioners, people, to understand what resources they have, how those resources can be used for addressing a range of health issues on the ground, that is in fact to be seen in the larger paradigm of climate resilience. In fact, everyone talks about, local and the local being very important and the local before the global, etc. But what does it mean? It means, in fact, that the Ayush systems become most relevant because they are all locally grounded. They are all ecologically determined. They are ecologically, spelt out. And I think that it needs to be emphasized that being able to look after the health of an area by the resources that it itself possesses is a very important contribution to the overall health system, and to the overall ecology. And we are all struggling to find climate resilient solutions of all kinds. I think in that sense, the Ayush systems are very, very important climate resilient solutions. This is something that we need to recognize. And we need to understand that those who are already doing it, and that's the other thing we need to recognize, is that a lot of things the government does not have to take on afresh or to do anew. So much of work, so much effort has already been made by thousands of people on the ground, many of which, an excellent example is what Sujata said about the Siddha, medicines available and which were quickly used during the COVID-19 pandemic. So likewise, for a range of other things, already a great deal of initiatives exist on the ground. So I think that if we are able to mobilize, document, and make available to everyone to see, look, this exists, and we are not looking at some utopian idea, we're talking about something that already exists on the ground, then I think that the incentive for people to be a part of this, to make it a part of their lives, becomes higher. And that's very important if we want anything to succeed. For a long time also, because now we are in this G20 leadership and we need to play a very important role, we would like to, and we know we have the capacity to play a very important role. One of the things that I think we really need to share across the world is from something I had learned from a very senior Vedian who spoke at a conference in Europe many, many years ago. And, in that conference, a lot of discussion was happening about how do we export Ayurveda or Ayush systems to the rest of the world? How do we make sure that laws allow all these things to be imported into Europe as medicine and so on and so forth? And he said, it's one of the most beautiful things I've ever heard, which was that we need to explain the first principles and the concepts of Ayush. Every country, on the basis of its own ecology, plant resources, understanding the constitution of its people in relationship to the nature in which they live, they can create their own Ayurveda. And of course, across the world, everywhere, people have actually done this. Europe has systematically dismantled its traditions, but very many other places still keep it. What we need to do is to emphasize and build confidence in these kinds of knowledges. This is very, very important because what we have principally lost, we have lost a lot of the knowledge base, but we have also lost confidence in what we have. And the whole confidence has been lost because we have been pushed for evidence-based. And I'm so proud that so many people here, including our distinguished moderator today, has contributed so wonderfully to this whole evidence-based narrative, this whole discourse about evidence, and has created so much evidence. And I think that in time of its leadership, the Indian government really needs to consolidate all this wonderful work that researchers have done in this country, in all the different Ayush systems, put it together and say, here, we have the evidence. And let us build our own confidence and help people across the world build confidence in the medical knowledges they have. That is the way forward, because now we are very clear. Any leadership is for the planet. It's not for one country or a group of countries. It's for the planet. We are facing a very real possibility of extinction, and we need to respond to that kind of urgency. And I think that if we are able to do that, that would be a real marker of leadership. And I really hope that these words carry to those who make decisions. And I know that, those who are here, many of you who are here are involved in this. And I think that if we are able to do this, I think that we have made, the impact we need to and that we are capable of. Thank you so much, Ramana, for this wonderful opportunity.
Thank you so much, Dr. Mantuliga, for enlightening us with your views and also for joining, from Germany. I think you rightly pointed out that Ayush is not a poor man's option, that we should look at it as an option to use the local resources and achieve, self-reliance in a natural way. Thank you so much. Now I'd like to, we are going, to the speaker, Dr. Ghazala Javed, a little early. I mean, she has been so kind to be present here today in spite of being busy with the Unani Day. So Dr. Ghazala Javed is a scientist at the Central Council for Research in Unani Medicine at the Ministry of Ayush. And I would like to now invite her to share her views from the perspective of Unani medicine. And I wish you also a belated Happy Unani Day to the whole community.
Thank you so much. Am I audible?
Yes, please go ahead.
Yeah. So, respected organizers, my colleague, Dr. Ram Manoharji, esteemed co-speakers in the webinar. So it's an honor to participate in today's webinar being organized under one of the working groups of C20, and which focuses exclusively on integrated holistic health and traditional medicine, which is one of the verticals under this working group. So before I begin, Happy Unani Day to all. I just reached home and the first thing I'm doing is sitting here because I promised Ram Manoharji that I will be there. And I must mention that we had a very highly successful 2 days international conference as part of Unani Day celebration. And I'm mentioning because I want to highlight what kind of government patronage and what kind of support we are getting for Unani system of medicine. As for other Ayush system, we had presence of our Honorable Union Minister, Minister for Ayush, Sarvananda Sonowalji, Honorable MOS Munjiparaji, he was also there, and then Honorable Minister of Law, Kiran Rijijuji. So they all were there. I'm just mentioning, it was such a proud moment for us today. They all were there and their blessings were theirs. And we had invited so many students and they were so hopeful for their future. And a strong message has gone from government that a lot is being done under the visionary leadership of our Honorable Prime Minister of India, Shri Narendra Modi ji. So now I'll begin with my talk. I was so happy that I wanted to share what we did in these 2 days, and we had this thing. So indeed, I was listening to our earlier speakers. Ayush systems can play an important role given the kind of support provided by Government of India. Coming to the system, Unani medicine, it is one of the recognized system of traditional medicine in India. The system is holistic in nature and the fundamentals, diagnosis and treatment modalities of the system are based on scientific principles, and Unani medicine passed through many countries, getting enriched along the way before being introduced in India around 8th century. And since its introduction in India, India's continuous contribution to the further development of Unani medicine has been globally recognized. And I can proudly say that India is the world leader when it's come to Unani medicine and the kind of infrastructure and support we have got. So in India, the system has been systematically nurtured and integrated in the healthcare delivery system with ample government support in terms of patronage and funds, with its wide network of quality educational institutions, comprehensive healthcare facilities, and state-of-the-art research institution and quality drug manufacturing industries in place. So a lot of countries, looking at us for experience sharing from India, how we are propagating Unani system of medicine. So, and there's a large network of Unani educational institutions spread across India, engaged in academic and research activities. So considering the importance of infusing the wisdom of Unani theories and practices with the methodologies of modern science, the system is being scientifically validated through clinical researches. And the major challenge that the traditional system of medicine are facing in the global acceptance is the question of standardization, quality, and safety of the drugs. And this has led to the application of more stringent quality control measures in the manufacturing of Unani drugs, and pharmacovigilance programs are also implemented for monitoring their safety. And Unani medicine has a global presence, and it is practiced in several countries like Bangladesh, South Africa, Pakistan, Sri Lanka, Tajikistan, UAE, China, and it's popular with different names. It is sometimes known as Unani Tib, Persian medicine, Eastern medicine, or Uyghur medicine. Coming to the organization in which I'm working, it is Central Council for Research in Unani Medicine, one of the apex research organization of Ministry of Ayush, engaged in research and development work related to Unani medicine. And at international level, we have signed MOU with Avicenna Tajik State Medical University, Dushanbe, Tajikistan, and we have also signed MOU with Bangladesh, and there one Unani chair has been deputed to propagate Unani system of medicine. And earlier we had an MOU signed with the University of Western Cape, South Africa, where a Unani professor was deputed for 3 years to promote and propagate Unani medicine. And we also have an MOM for cooperation in the field of traditional medicine with Iran. So what I wanted to highlight here is that there is futuristic work going on for Unani medicine in India. And if I highlight the work done at World Health Organization under the MOU signed between WHO and Ministry of Ayush, with the efforts of ministry, benchmarks for training and practice in Unani medicine has been published. And the WHO benchmarks for the practice of Unani medicine defines the, I am sure you all are aware, the minimum requirements criteria for establishing practice in Unani medicine in WHO member state. And this document provides WHO member states with general and minimum technical requirements for quality assurance and regulation of Unani medicine practices. And the same with WHO benchmarks for training in Unani medicine, which defines the minimum requirement criteria for establishing training of Unani medicine in WHO member states. And this document shall serve as a reference to national authorities to establish, strengthen regulatory standards to ensure qualified training and practices of Unani medicine. Very recently, WHO International Standard Terminologies on Unani medicine, along with the Ayurveda and Siddha, has also been published with the untiring efforts of Ministry of Ayush. So the proactive initiatives taken by the Ministry of Ayush contributed in creating awareness in the society regarding improving immunity and health through simple Ayush measures. So my earlier speaker were talking about the role of Ayush system during COVID-19 pandemic. The contribution of the Ayush system in maintaining health and improving immunity have been recognized globally as well, and use of Ayush system has been increased. Unani medicines like Khamira, Marwarit, and Joshanda were popularized along with other modalities for boosting immunity, and Council also conducted some research studies to generate data, and I'm sure that these results will further help us in conducting more structured and planned research activities. Then what can be done today? I also want to mention, we all know that millets have been an integral part of our diet for centuries. And in addition to a plethora of health benefits, millets are also good for the environment with low water and input requirement. So, and we know with the aim to create awareness and increase production and consumption of millets, United Nations at the behest of the Government of India declared 2023 the International Year Millets. So today, during the lunch, we had served millets to our registered delegates during our conference. And it was as per the vision of our Honorable PM and our Minister. So Unani medicine, just like other traditional system, has a detailed concept of diet therapy, which also lays emphasis on millets and its uses. So Ministry of Ayush is already highlighting this aspect, but we can create more awareness in this regard and also explore creating taglines for other dietary advices also. So similarly, how we are popularizing the efforts of millet, we can highlight, in different different disease conditions and for preventive measures. In Unani medicine, you can find this concept of diet therapy, so many books written by Unani Hakims, where they advocates what diet to eat and what not to, and then lifestyle modifications. And I'm sure that highlighting these and popularizing this will help in preventing and managing some common ailments as well as non-communicable diseases and many other diseases. So if you feel they'll, for example, if somebody is having joints pain or rheumatoid arthritis, first thing Unani physicians, they advise them to avoid sour thing, curd, and take hot milk with turmeric, which is known to all. So, and as per temperament, we had also launched an app where with the touch of the screen, you get a questionnaire, and after answering that questionnaire, you can analyze your temperament, and then you get dietary advice, what to eat, what not to eat as per your temperament. We call it Mizaj. In Ayurveda, it is called as Prakriti. So in our conference also, we highlighted. So this is one of the important area where which we can bring to forefront. We are already doing it, but I still feel there are many, many advices, just like millets, which we can highlight with proper taglines and popularize. So another important area where Unani medicine can come forward is which we call as regimen therapies or ilaj bit tadbir. So it's a very strong area of Unani medicine. Where therapies like Riyazat means need-based exercises, Dalak, certain massages, cupping. I'm sure you all know where we apply cups by creating vacuum and then diverting the morbid humors, and leeching, where medicinal leeches are used. These can be, we are already doing some work. These can also be brought to some disturbance. This can also be brought to forefront as preventive and curative measures. And I'm sure because, if we'll see whenever we look at this aspect, regimen therapy being mostly it involves non-medicinal techniques or procedures by which Unani physicians modulate the patient's habitat, lifestyle, and dietary habits of the patient. So this will appeal to the masses. So we can bring it to the forefront, and we are doing it, and we need to further highlight. So to conclude, India has done noteworthy work in Unani medicine at national and international platform. Through this platform, we can further explore the strength areas of each system and Ayush system and learn from each other experiences. Thank you so much.
Thank you, Dr. Ghazala, for giving those very interesting comments and remarks about how Unani medicine is developing, and all these efforts clearly point out that India is the hub for the development of traditional medicine in the future. Unani medicine is a system that came from outside, but it is growing, in such ways as you have mentioned. So thank you once again for joining us on Unani Day. I'd like to now move on to our next speaker, Dr. Nirmal Ghosh. He will represent homeopathy, and he was a former head research in homeopathy at the Department of Homeopathic Medical Education, Department of Ayush, Government of Kerala. So I invite you, Dr. Nirmal Ghosh, to share your views.
Thank you, Ramji. I think I'm audible.
Yes.
Yes. So I think all the speakers actually touched almost the relevant areas related to this kind of holistic approach, mainly Ayush. But I just want to first emphasize on the philosophy of One Health, actually, the point which we had to realize that this scope of biomedicine is actually very much limited. See, now the pandemic proved that this kind of meeting up these kind of challenges, we have to have a total approach in which we'll utilize all possible levels of interventions like social level re-engineering, ecosystem re-engineering, and utilizing the local health traditions and all this kind of traditional knowledge approach all over the world in its own geographic limitations. So if you look into these axiological aspects of One Health, actually when we are presenting this One Health philosophy in this sustainable development goal context, there is a kind of, I think it's a kind of mistake, or I don't think it is deliberate, but mostly we observe that this One Health philosophy is equated to one ICD, one drug, one world philosophy. That is not the case. So in that aspect, we have to be very, very careful in putting a kind of policy approach which can accommodate all this kind of pluralism. So homeopathy is not at all a traditional system. It's the most modern system, actually having very 200 years of its origin. So in the context of India, so if you take this pandemic itself, once government of India issued guidelines to implement this kind of a traditional or this IHH interventions to handle this kind of pandemic, there is a huge confusion among the stakeholders to implement it in different levels. Why? Because mainly three things are lacking in this domain. Because one is evidence, second is most of the time we are challenged with this scientificity and a lot of technical demands, which is a mandate to meet all these kind of situations. Third thing is actually proper mobilization of the resources. So in the context of homeopathy, what happened is, even though government of India issued this kind of policy documents through CCRH, its Central Council for Research in Homeopathy, it took a very long time to reach the implementation level. So we believe that this is due to the lack of documentation. So this lack of documentation in this evidence-based practice of traditional health systems come under a different purview of philosophy. So this biomedicine or this reductionist approach cannot provide this ecosystem for analyzing these kind of evidences. Actually, even Ayurveda, Siddha, all these kind of traditional medicines are developed based on phenomenological framework. Means it's a like of a long-term collective consultation of real life experiences of utilizing these kind of interventions and methods and documenting it over a period of time. So this kind of phenomenological approach will only help traditional systems of medicine, even including homeopathic system of medicine, to come upfront in this evidence-based race. So what I'm coming to emphasize is like, what I'm coming to say is like, if you are looking for evidences or this kind of technical documentations which can reflect the outcome of traditional or IHH-based interventions, we should not utilize the same frame of references to analyze those data. Actually, only due to that issue, even though India having a huge potential in utilizing IHH for this kind of management, it took very long time, and due to that, in public health, we can see from data that it took long time to reflect the strength of IHH in managing pandemic. But I know that like a lot of efforts has been done by Ministry of IHH, and even Ramji is a part of that team who has done like documentation, and in Tamil Nadu Siddha group, they have tried level best. In Kerala, Department of Homeopathy also tried. Now only we got legal permission to do a trial in homeopathy in COVID-19 in Kerala. So what I'm coming to say is we can expect more this kind of catastrophic means public health issues because of this imbalance between this human environmental conflict. So from our point of view, we believe that utilizing the proper axiological and pluralistic framework to accommodate all the epistemic aspects of systems of medicine like Ayurveda, Siddha, homeopathy, Unani, and integrating it with the yoga. And maybe this whole package can be integrated with biomedicine or modern means allopathic system of practice, which can really do wonders in public health. And I think in India only this much organized structured network of public health ecosystem of Ayurveda and homeopathy and Siddha is existing, especially like in southern part of India, like Siddha system is very prevalent in Tamil Nadu, like homeopathy is having a very big public health ecosystem network in Kerala. So I think we had to take the lead in providing evidences and providing successful public health models to the world and take it to this kind of lead in global public health. So this is my view, Ramji. Thank you.
Thank you, Dr. Nirmal Ghosh. Thank you so much for coming here. I know you are a scientist and you bring a unique perspective with your experience in homeopathic research. And you rightly pointed out that, one health, one earth does not mean, simplifying the whole humanity into, one individual, one disease, one medicine. I mean, this is where pluralism and diversity comes in. So thank you so much. Now I'm moving on to our next speaker now, Dr. Apar Saoji Rao. He is the principal of the School of Yoga and Naturopathic Medicine in Vyasa University. His research interests include psychophysiology of yoga practices and naturopathic therapeutic modalities in health and disease. So he's here representing yoga and naturopathic medicine, Dr. Apar Saoji Rao.
Thank you so much, and it's amazing to be part of this whole panel, listening to my fellow speakers. A lot of insights on how the traditional medicine can be part of the integrative holistic healthcare that we are looking for the future. Looking at the perspective of yoga and naturopathy, basically the origin of both the systems are to align ourselves with our own nature. Yoga is to understand your internal nature, and naturopathy is all about aligning yourself with the laws that govern the entire nature. And today, the health problems that across the world people are facing, COVID is one strange example, probably, but majority of the non-communicable diseases where Ayush as a whole and holistic systems as in totality across the world can have a major role to play is going to be lifestyle disorders. And lifestyle disorders are basically going away from this very nature of your own self, deviating from the natural alignment, be it your food, where the improper diet is there, lack of exercise is going to be a major cause of a lot of health problem. Psychological stress, yoga says ananda is your inner state, and you're never at that state. And that is why we get in problem. So basically, we are adapting a lifestyle which is harmful to us, and yoga naturopathy as a system, and even otherwise, all the Ayush systems are talking about lifestyle which is holistic. And that is perhaps one major area that we will probably have to work together. And unfortunately, again, not in India, but a lot of research in lifestyle medicine, be it yoga, be it naturopathy, is happening across the world. And somehow we will have to gather pace in generating evidence, because integration everywhere is going to require that kind of evidence base. China is a major example that we can take up, where Chinese medicine is propagated with the conventional allopathic medicine, and Japan as well, basically because there is a functional integration that happens. In India, we are trying to do the integration, but it is very much in All India Institute to a lot of tertiary care centers now we have Ayush systems, but the patient has to choose. But we will have to start creating awareness with the consultants of conventional medicine about Ayush as a whole. And that is where probably evidence is going to play a very, very important role. Yoga, in fact, has shown the path forward where a lot of integrative studies have happened, whether it is oncology as an example. SVIASA has been a part of a lot of oncology-based studies, both in Bangalore and as well as in the US. We're part of NIH-funded study at MD Anderson Cancer Center on breast cancer, where cancer care is something that we are looking at. So evidence generation is a very, very important area that probably we will have to work as uh, the whole of our systems. And another problem that we have, my fellow speakers have kind of mentioned it, is we are looking at this evidence generation as well from the perspective of biomedicine, where already the approach to generating evidence is very fragmented. Whereas the Ayush systems are very much holistic. They are looking at the whole systems approach, and therefore the methodology applied for research as well will have to become more systems-based approach rather than looking at piecemeal-based. We cannot generate evidence of doing one asana and looking at the effects of it. Rather, we will have to look at how yoga as a lifestyle, naturopathy as a lifestyle, when I apply, how is it going to impact? And that is one very, very important area that we probably have to work. The focus while we implement yoga and naturopathy is going to be prevention. Uh, Rajiv ji, in the opening remarks itself, said it is primordial to tertiary prevention that we will have to probably work. So prevention is one major area, and then rehabilitation is another major area which probably we will have to work on. The strengths of yoga and naturopathy as a system is going to be simplicity of the approach that we have, the self-care, which is very much possible. You don't really have to uh, depend on a lot of people. Once you're trained in doing something, the patient can start doing things at home. So that is another very simple and beneficial role that yoga naturopathy can have. The third aspect is perhaps the cost effectiveness of the system, because the lifestyles that you're able to adapt can be done at home. And perhaps that is the reason why Mahatma Gandhi wanted naturopathy to become the primary system of medicine for healthcare in a country like India. Uh, the acceptability of yoga is another very, very important reason, probably, where we can take it forward. We know the International Day of Yoga has been accepted wholeheartedly by the entire world with the whole understanding of Vasudhaiva Kutumbakam. So yoga, the word is to join, and yoga is joining the world through International Day of Yoga. But unfortunately, again, the practice of yoga remains with that day, and it doesn't percolate into everyday practice, which is perhaps a challenge that we need to work on. One last thing that I would probably mention here is going to be a challenge in bringing in yoga and naturopathy as a system of medicine, the regulation of it, uh, because the practice of naturopathy is very diverse. In the West, it is comprising of homeopathy and nutraceuticals. In India, it is more inpatient-based holistic medicine, drugless healing methods. So bringing in that standardization is going to be a challenge for which the government of India probably will have to bring in those regulations. With that, a few views on yoga and naturopathy and how it could contribute to the holistic integrative healthcare is what I wanted to present here. Thank you so much, Ramji, for giving me this opportunity to talk among this eminent panel. Thank you so much.
Thank you so much, Dr. Apar Sawaji, for sharing this perspective from yoga and naturopathy. And even while you highlighted the importance of lifestyle and nature centered living, you also pointed out the irony that integrative medicine is not developing in India in spite of medical pluralism. And that while this has to be evidence driven, we need appropriate evidence, the right kind of evidence to propel this forward. So, thank you really very much for your views. Now we are coming to our last speaker today, Dr. Vivek Nambiar. I mean, he's representing biomedicine, and sir, you're going to have the last word today in this meeting on traditional medicine. So he's a HOD and professor of stroke medicine at Amrita Hospitals, Kochi, and we are very excited to hear from him because he was also working on a project integrating Ayurvedic treatments, for post-stroke recovery. So, Dr. Vivek Nambiar.
Very good evening to all. First of all, I thank Dr. Ram Manohar and Dr. Priya Nair for inviting me into the late panel and very important discussion. And I think this is the right time. India is at the presidency of the G20, and this is the time where there is a resource crunch across the world. And this may be the right time to talk about integrated care and holistic health, because even though Ayush is somebody was previous speakers were talking about the cost and all. Cost is always a problem, because when indigenously available treatments are available, that will be usually cost effective, and there is no more importing of drugs and medications and all. So I think this is the right time to discuss. As a person who practices modern medicine, I think holistic healthcare definitely has got several components, and of course, I think it should be a combination of, or it should be taking advantage of all the systems. You cannot say that this system is not benefiting. There is no evidence. I think there is good thing in all the systems, and it should be personalized to the patient. And where once we treat a particular disease, there will be several components which we may have missed, or we may not be involved too much because we would be concentrating only on certain aspects of the disease. So in those situations, definitely there is a role for all the complementary or traditional medicines, so that rather than in acute situations, just like sometimes we have seen very good results. I think Dr. Sujata was talking about the Siddha treatment of the pandemic, the COVID in Tamil Nadu. That is a very effective, positive trial. It was good that a trial was introduced, and it showed positive results. Like that, in acute situations, we need more trials. And in the chronic phase, of course, where modern medicine is a little bit not very keen or not very stressing, is about the lifestyle, the environment, diet, and other areas. There, of course, these traditional practices has got a role. But I think for we have to really strengthen these practices and systems. And for strengthening the systems, we really need evidence, because that is one of the issue. Even though we would say evidence is not important, evidence is required. So that's what we were trying to do in Amrita Institute with the funding of the ICMR. We were trying to, because in order to get acceptance, if you want to make these systems more stronger, we need some amount of data to show that these are effective, so that people will accept. So what we need is acceptance. As my previous speaker was talking about yoga had luckily a very good acceptance, and maybe it is one of the best the complementary alternative medicine, because it is very preventive in nature. So, but in other areas, especially when we are looking for cure, and especially acute and chronic diseases, there should be some sort of evidence, because otherwise the issue is it may be really good, but the acceptance of the public and the policymakers would be more if we produce evidence. So one of the advantage of the modern medicine is we are continuously researching, we are continuously pumping in time and efforts to modify the treatment. Evidence-based changes will happen to the guidelines. And so this is an ongoing process. I think we have to, for this, all the they were very good. There is I personally believe there is really a treasure of knowledge and other things to be explored and to be brought out through proper research in the traditional practice. So for example, I was just trying to do, we have Vedic Kalari treatment, which is a sort of, Kalari is a martial art which is prevalent in Kerala. And we are doing a trial on this martial art rehabilitation. This martial art is also used for curing the fractures and all the musculoskeletal ailments. It's a conventional method of treatment. It's very effective. We know that it is effective. Some of the public, many of the people, or the modern generation or the new generation people, they do not know there is something called Kalari. So Kalari is prevalent in North Kerala and also in many parts of Kerala. But it has got a lot of value. But in order to make it more acceptable to the public or to the policymakers, we have to create evidence. And of course, my previous speaker was talking about when you produce evidence, and especially in these conventional systems and traditional medicine, it will be the parameters would be slightly different compared to the modern medicine. Like we would be looking into so many chemical parameters and all those things, but we were trying to, because there was a challenge in producing. We were doing a trial on stroke treatment called Restore trial funded by ICMR, but we were facing challenges to how to determine the outcome. Like because we would look into the scan, we would look into all those things in regular medical trials, but we were trying to looking at the whole results, like all functional outcomes after the treatment. So I think, as my previous speaker has mentioned, there could be some sort of holistic outcome measurement rather than looking into small individual chemical parameters and scans and all. But however, when we do these treatments, we also should be cautious about the safety, because if there is no long-term outcome or long-term safety data, we cannot blindly say that that is effective. Of course, it may be curing like 5 people after giving 10 people the medicine. It may be curing 5 people, but another 5 people and the whole cured people can have another adverse event in the long term. So these long-term safety studies and efficacy-based studies of all the traditional and complementary medicine is definitely required in order to really make the purpose of holistic medicine attainable. Because of course, it is in India we have Ayurveda, we have all other traditional systems, and of course it's a good move from the government, so they are funding this research. So I think this the practitioners should be also open to research and innovation, and so that we will produce more data. And best example is the Chinese medicine, as my previous speaker was talking about, like the artesunate, which it's a worldwide treatment for malarial fever. In resistant malarias, we are giving artesunate. So artesunate is a traditional Chinese medicine they used to give for fever. But after research, and they isolated the chemical, and that is being now the standard of practice for falciparum malaria and saved millions of lives. So I think there is always there's a scope for all the systems. I think there is a role for each and every systems in the holistic care. May not be in the acute phase, but maybe a lot in the prevention, a lot in the chronic phase and rehabilitation. But only thing, we should be open to a lot of research and data collection, so that we can because people can make informed choices about the treatment. So regarding integration, I think it could be either an integrated system, or it could be a system independently working where the patients can choose their own line of care. With a lot of information, but that information should be true, and that should be research-based. So we are not talking about the outcomes and evidence-based methodology, but the outcome measurements and the data should be there, so that this will be more acceptable to the people, and people would be able to choose these things. I think always there is a scope for all the systems, and we hope by the new governmental policies are coming. So we have now the G20 presidency as well. So we will be making definitely a different world, making this holistic health available to all people for the health of the planet and the whole humanity. Thank you so much. Thank you.
Thank you, Dr. Vivek Dampier. Thank you for summing up and, re-emphasizing all the points that the earlier speakers mentioned, especially why there should be diversity and pluralism in medical healthcare systems, and how we can take advantage of the strengths of different medical systems with a patient-centered approach, and also about, the right approach to develop evidence. I think that was a very nice sum up of the whole session today. So it was a fascinating, discussion on diverse perspectives on the field of traditional medicine. And I think we now have a baseline view of how the pluralistic healthcare system of India can evolve into an integrative and inclusive approach to healthcare, and perhaps also serve as a model for the future of global participation of CSOs and NGOs to help in the task of framing policies which are not only inclusive and implementable, but of also value to the society. So we count on your active engagement, contributions, and support as we move forward. We have a few questions. I thought we'll ask at least one or two questions to the panelists, although we did not plan this earlier. So one question is from Alka. Can someone explain with specific examples how current approaches to childcare needs to be changed? Of course, there is inadequate nutrition, etc. So do we need a different approach or an upscaling of the current policy? So who would like to answer? Rajiv ji?
Okay, so I think typically when you look at underweight children and stunted growth children, a lot of effort is going into nutrition. But what Ayurveda and traditional medicine also helps is the ability to assimilate that nutrition. So what we often miss really is that just giving inputs is not enough. So in the health, wellness, nutrition programs of the government of India, bringing in traditional medicine and probably across the world, these inputs help the child to grow properly with locally available food. As Professor Madhulika also mentioned, the role of culturally sensitive, locally available inputs is so important. And this is how, pediatric care at a mass level can be impacted by traditional medicine.
Okay, thank you. There's one more.
Sorry, and apart from that, in pediatric developmental disorders, Ayurveda can play a huge role, as we all know, right from cerebral palsy and the autism spectrum disorders and mental development itself. There's a lot to do.
Yeah, thank you, Rajiv ji. Another question is from Rajanish Kumar. Why are people tentative to embrace alternative medicine? Where is this gap in understanding stemming from? How can professionals in the health community bridge this gap for the betterment of society as a whole? I think there are many questions here. We can just see another question in the chat box. What is the role of trace elements? Many concerns. So, would anybody like to answer this question? Why are people tentative? Sujata. Sujata can go first.
Yeah. I mean, it's not that people are tentative. Surveys have shown that societal acceptance for traditional medicine has always been there. Means it was popular. People use them as home remedies. But there has been a shift since, say, in the past 30 years. The newer generation, certain old practices have disappeared. The family structure, many things have changed. Earlier women used to be the people who are preparing these home remedies. With the increasing workforce participation, a whole range of socioeconomic changes have led to changes in household practices. So there is a shift and there is a discontinuity in knowledge, but it's not completely gone. Like I mentioned, when COVID happened, a lot of people went back to their practices of having herbal preparations. So, but when you have to introduce something in public health, and on the part of the state or organization, it has to be done in a more planned, systematic, and cautious way. So therefore, there are many issues in bringing certain things in public health, for which we need a more open discussion, and already measures are there to set up the evidence base for traditional and other medicines. There's a very vibrant community. Dr. Ram Manohar has also been part of such measures to introduce new ways of testing traditional medicines which don't violate their integrity. You can't apply the RCT model for traditional medicines blindly, but we need to test them. So there is wide acceptance, and this is very much true of South Asia. As I pointed out, the pandemic has revived some of these practices. But there are different strata of society, for some it's a cost issue. For some people, working classes, laborers, they want to have medicines which cure them immediately. If I have fever and I can't go to work tomorrow, I need a tablet or medication that will relieve me of the body pain and fever so I can go and work and get my wages tomorrow. So studies show people choose different kinds of medicine for different ailments. For certain things, they will go only to traditional medicine. For certain things, they will go to allopathy. So that is the character of medical pluralism. There are many studies on that. So I would not say that people are reluctant, etc. The responses from different strata are slightly different, but there is always a social acceptance.
Yeah, thank you, Sujata. We have, I'd like to ask Matulika to, just very quickly, and then Rajiv ji, because both of you raised your hands, and we'll really have to conclude after that.
Sure. Very quickly,
please be very brief.
Yeah. To complement what my friend Sujata has to say, number one, I think we need to remember that the kind of education we get, we all think that education is very important. But one of the things we don't realize is that modern education actually completely distances us from the kind of practices we have had. And one of the foundational things that we learn in education is everything that is new is good. The old has to be forgotten. This is true of much of knowledge that we acquire. Now, this is a fundamental approach to knowledge, which we have to question now. And to think that we need to engage with knowledge that we inherit, that has a power. At the same time, the second point that I would say is that not all knowledge that we inherit has to be uncritically accepted. The problem with a lot of science education, and forgive my colleagues and friends here who must be from that field, is that the critical dimension that is required to acquire any knowledge. Science is supposed to be about inquiry and about critical inquiry. But way too much of science education is not about critical inquiry, but about just accepting a lot of formulae, a lot of concepts, a lot of theories, without understanding their historical context or where they come from and so on. So we then, apply this to everything in knowledge that we have. And this is where our medical knowledge really suffers. I think that we need to apply this critical aspect very importantly. Why is it something that your grandmother tells you is relevant or not relevant? There are many things that grandmothers say which are not relevant, and one must question them. The ability to critically understand is not to criticize, but to understand analytically why something is important. Our education is not doing this. And one of the things that suffers is medicine. The third point that I want to say, when you bring these things into the public health realm, remember that this is, as a political scientist, let me make it clear that there's a play of power between different knowledge systems. Some knowledge systems are up against the biomedical system, in which there are many people, my father was amongst them, who were great acceptors and respecters of Ayush systems. But the dominant narrative is that, look, this is all some mumbo jumbo, and just be very careful. This play of power in the public health realm needs to be recognized, needs to be dealt with. And I think that all of those in the biomedical tradition who are respectful, who understand, and who are willing to engage in a dialogue with Ayush systems need to speak up. And they need to say that, a dialogue between knowledge systems is far more productive for the public health system than this kind of antagonism. Thank you, Ram, for the chance to speak.
Thank you, Dr. Ms. Rajiv ji. Please be very brief.
I know. Just very, I'm just building on what the previous two, respected panelists spoke about. But quickly, I think the problem stems from a total diversity of understanding of what constitutes traditional medicine. Everybody refers to it as grandma's remedies and this and that to one product. Is it medicine? Is it a, combined input of diet, lifestyle, medicine, therapy, counseling? Do we have, so if you look at the WHO framework for traditional medicine, and I think it's important to go back here, there is a clear framework for defining the maturity of any traditional medicine system. If you go and look at that, to take Kalari and look at that in one technique, and to look at Ayurveda would probably come at the real top, 5 out of 5 in a WHO framework for maturity of a traditional medicine system. On the other hand, some faith healer or folk healing tradition of fixing bone splints and fixing fractures, we should not equate these together, which is why the education, I'm just going back to the point, how traditional medicine has its, you could get a complete diversity of opinion as to why we need to bring evidence, this, that. These narratives need to be through dialogue, and maybe the C20 platform becomes a forum, as I told in the beginning, where we are able to engage with all the stakeholders and educate them what really is the current status of Ayurveda and traditional medicine. Thank you very much.
Thank you very much. That's a very nice, again, sum up, of our session today. We are already run out of time, so we'll please stay back to view a video